Welcome, everybody. This is the BTOG Advocacy Training webinar. My name is Cecilia Pompili. I'm BTOG Steering Committee member and Associate Professor of Psychosocial Oncology and Thoracic Surgeon at the University of Hull, focusing on patient-reported outcome and patient involvement in lung cancer care. This is part one of a series of training webinar to give anyone who wants to be professional patient advocate or for those already professional patient advocate looking for an update and insight into what they can do to represent the patient view in research. It is important to say that sponsors of BTOG do not have any role whatsoever in the planning, content, or delivery of anything discussed. It's my great pleasure to introduce Sally Hall and Allan Hackshaw. Sally was diagnosed with EGFR positive lung cancer with exon 19 mutation over 10 years ago. Sally is an advocate, member of the BTOG Steering Committee and the BTOG Research Group, and she has participated in numerous advisory board, trial design groups, and committees, sharing her experience to raise awareness and to ensure that the patient is central in research development and related patient information. Allan is professor and director of Cancer Research UK and at the University College of London, CRUK Cancer Trial Centre. Allan is a former member of the BTOG Steering Committee and a current member of the BTOG Research Group. Allan has worked in medical research since 1992 and has been crucial in designing also this webinar series. So I really would like to thank both of you for this involvement. Before we begin, I would like to briefly explain the purpose of this webinar series and how these three sessions fit together. Again, with a big thank to both of the other speakers. Patient advocacy can take many forms, and there are numerous ways in which individuals can contribute to improve cancer care and especially research. Through this series, we hope to provide an overview of what patient advocacy means in practice, highlighting both the opportunities available and the training and support that can help people become involved in a meaningful and informed way. Today's webinar focuses specifically on foundation of patient advocacy. We will discuss the different roles that advocates can play, the skills and knowledge that may be useful, and some of the training opportunities that are available for those who wish to become more formally involved in research and healthcare initiatives. In our second webinar, we will explore research advocacy in a greater depth. We will look at how patient advocate can contribute to the development of research proposals, how to interpret and understand research finding, and how their perspective can help ensure that research remain relevant and accessible also to all the patients and families. The final webinar will build on these discussions by focusing on practical opportunities for involvement, sharing experience from both researcher and in general stakeholders and advocates, and highlighting again resources that may support future engagement within the research community. Our hope by the end of this series, participants will have a clear understanding of the main ways in which patient advocates can contribute and feel more confident about identifying opportunities that are right for them. So it's my pleasure now to introduce Allan's lecture on what training and support could a patient advocate be offered when they take part in the development of research proposals. So again, thank you so much for all your support in this, Allan.
Thank you, Celia. Hello, everybody. I'm Allan, and it's my pleasure to give a very top-level view of what training support could be given to patient advocates when they become part of a research team to develop and conduct research proposals. I remember going back many years ago in research, and the concept of patient advocates was unheard of. The investigators, the clinicians, that we designed things that we assumed patients would want and like. And there were hardly, if any, patient advocacy involvement at the time. And it's now gone completely the right way now, where they're an integral part of research. And so this is why we're doing this series of seminars, to show you what support you can get and to encourage people to take part. We are all working together, so the investigators, patient advocates, the NHS, to find better studies, better treatments, better ways of detecting disease. And the aim is to work together to build high quality studies, because they're the ones that are going to have impact on clinical practice and ideally will benefit patients in some way, whether it's living longer, better quality of life, or finding treatments that are safer to tolerate. Once a high quality study is developed and approved for funding, it can then be launched across the UK. And many funders now, such as Cancer Research UK, the government, NHS, require patient advocacy to be a clear and important integral part of building research proposals. We don't want low quality research out there. We don't want we don't want research that's got minimal impact on patients. That's from years ago. Now we're in modern times and things have changed for the better. So who are patient advocates? There's various types of them. There are obviously patients themselves, and many of them are probably still undergoing treatment. There are cancer survivors. There's relatives or carers of cancer patients, including parents. And there's also people who represent cancer support groups. So you can see they've got quite different viewpoints. And because they have various backgrounds, they sometimes require different training needs. And that's all should be provided by the research team. And whoever they are, it's always made clear from the start what the roles and responsibilities are, and explained to people in an easy to understand ways. Because if patients don't know what they're being involved in, you can't expect them to do it effectively, and you don't want to scare them off either. So you want to make it look as straightforward as possible and give them as much support as they need. Where patient advocates really come into the fore is that it's the lived experience. It's a lived experience and that knowledge that makes them special. And they can often see things that the research team, are usually experts in their own field, by the way, that can't see something that's sometimes right in front of their face. And it's people should never think, patient advocates, that they have to know everything. So there's no member of the research team that knows everything about that research project. A research team is a collection of people with different backgrounds, and together we design and deliver high quality research. And sometimes people think, well, I've got to know so much and it might put me off. And that isn't the case at all. And even when you get some high flying experts as a part of the research team, they still don't know it all. And here's a graph that I stole actually from a patient advocate from another colleague that we work with. And I think it's a nice thing. I think it reminded her what she thought was expected starting in research. So you start at the left on the side, and no knowledge. You think of what earth is going on, and very quickly you then think you know everything, because you see all these fancy terms and you start to get to grips with what's happening. But then there's more thrown at you in a good way and as part of the team. And then over time, you see the knowledge getting higher and higher, and it starts to make sense. And if it doesn't make sense, there's always support to help you to try and explain things. And one then often ends up in a situation at the end where you think, actually, there's more to research than you thought there was at the very beginning. But that's modern research now. It is a bit more complicated than before. We've got so many different treatments for lung cancer and different ways of targeting them as well. I remember a study from several years ago. It's not lung cancer, but it's a prime example of where you wanted patient advocacy. It was for treating early stage throat cancer, and it's comparing surgery or radiotherapy. And the investigators and surgeons are really, really keen on it. And then, so you can see on the left-hand side, here are the two treatments. It's a randomized study. So patients are going to be randomized to one or the other, and they've got 50-50 chance of getting either surgery or radiotherapy. So there's the surgery. It's an operation, and most patients go home the day after. That's it. If there is any side effects, fine, you come back into hospital or seen afterwards. But as in terms of the surgery itself, that is it. If you look at the radiotherapy, it's coming in about 4 days a week, each week for several weeks. So take a few seconds to see if you spot what's not quite right with that. Because this study was funded, load of experts involved in it. We set the study up, ran it, and guess what? Patients did not like it, quelle surprise, because the radiotherapy involved the patients going to hospital, traveling, paying, whether it's car, public transport, many more times than with the surgery. And so what they were faced with, what they thought was a choice between surgery and radiotherapy. So of course they're going to take the surgery. And so this trial lasted for quite a few months, and then we realised actually it failed to recruit. And so you can see the integral and complete importance of patient advocacy from the very start when you design research projects, because this could have been designed in a different way, or perhaps not even get off the ground in the first place because patients wouldn't want to take part. If I remember correctly, there was hardly any patient advocacy in this study many years ago. So this is one of those old studies that I referred to earlier on, and that's hopefully now this wouldn't exist. But we do need patient advocates who are very keen, enthusiastic, to be part of a research team and say, yes, I like that aspect of the research, I don't understand that, or I don't like it. And that's part of how we do things in a modern way, and it's very collaborative. So what kind of support can be given to you? There's logistics support, so helping you to arrange meetings with the trial team or indeed other patient advocates. Sometimes these meetings are in person or they're online. Several patient advocates are not very IT literate, and that's no problem whatsoever. There's always going to be support to help you if you wish. There's certainly financial support. We're asking people who may be in work or they might have to go out of their way to do something as part of a research project. So patient advocates get paid for their travel costs. They also get paid for their time. It takes effort to read something and plan something and talk about it as part of a group, and even payment to attend meetings. There are national rates and recommendations for this financial support, but each individual institution will determine what they pay each patient according to the type of work they do. And I think this is a really valid thing to get across to patients. They're not doing it for free because they are doing some work for a research project that's going to be integral. And don't forget, if you work with a research team, at least one of us is going to be quite friendly. So if you ring up and say, actually, can I chat about the research project offline in any way, any kind of advice, there's always going to be somebody there to give a nice little chit chat in a nice, friendly way, and doesn't make things look as off-putting as it might seem at first sight. Much of research looks daunting when you first see it, and the aim of the support is to not make it look daunting at all and make it look collaborative, almost like a bunch of friends talking with each other. So in terms of developing research projects, there's several aspects one can do as part of this. So one is understanding patient-facing documents. So the research team will help the patient advocate to understand what the study is doing, what might be its role on clinical practice, understanding what the study is about and why it matters to patients. Then the patient advocates who are part of the group will then say, yes, I agree, or no, I don't, or here's another angle that you should take. And so there's plenty of examples now where the patient involvement research, they've helped with the design of the study, what kinds of things that you measure on patients that would go into the study. And so that's why that's an important part of research. For those who want want a bit more confidence, we can help you develop presentations or even do simple talks at meetings or in small committee meetings. Many people are scared of public speaking, completely understandable, but if an opportunity comes up, there's support to help you if one wishes to do so. And as you go through the research project from the beginning, even during as well, there's bound to be gaps in one's knowledge. The research team will also have gaps in their own knowledge as well, by the way, and there's always going to be support to help you fill those gaps where possible. And again, using the other members of the team, other patient advocates, and researchers here and elsewhere. So I hope I've given you a nice overview of the kind of research support that one could be given to you if you do like to take part in research. We'd really love to hear from you. We are looking for more patient advocates in lung cancer. Feel free to ask researchers at BTOG, at your local cancer centre, especially if they're doing research. Word of mouth. There's various ways that you can approach people to try and get involved in research. And all I can say is don't be scared by it. Just try it out for a bit and see if you like it. We've worked with many patient advocates over the years, and they all love it. They get a lot out of it, they get experience out of it, and they get some knowledge out of it. And that integral part of the research team, we learn from them and they learn from us. And I think it's been a fantastic way to take lung cancer research going forwards. Thank you very much.
Thank you very much, Alan. It's been terrific. And I also echo your invitation to reach out, researcher at BTOG, because we are always very, very keen to help or give information or signposting to resources or even simply support presentation or any of these activities. So I think it's very, very important. And now I think we have the pleasure to invite also Sally, and we'll have a really, really nice chat and really learning from you, Sally, from your experience and trying to dig into this conversation a little bit more. So I'll start with a very generic question, but I think it's very important for a lot of our patient advocates is about have you enjoyed being a patient advocate during the last many years?
Well, thank you, Cecilia. Thank you, Alan, for your presentation. I absolutely love it. I didn't think I would. Some people watching this may realise I had a healthcare background and know, well, she knows all about it. But I had no knowledge of research really until I went into this. I'd done some advocate work with patient-facing literature and with the Cancer Alliance, and I got into research through word of mouth. But oh, you can do this. It's like, oh, all right, can I? But once I was in there, I thought, yeah, I actually really like this. It gives you a wider understanding of what goes on. I think prior to that, I thought, well, where is all this research for lung cancer and why does it take so long? But now I'm realizing that I wouldn't be here without the research that went on 20, 15 years ago. And I think it's a way of giving something back.
Alan, do you want to go next?
It feels a bit strange, Sally, doesn't it? A fireside chat without the fire. We should have been sat around a fire with a glass of wine in our hands. Perhaps next time. So a couple of things I'd like to ask you about, but I'll ask you one first. At first, were you a bit wary about taking on this role and what it might involve?
Well, yes, to be honest, it was sort of, well, all right, I think I can do that. But I was a bit wary of meeting some sort of boffins and high-flying academics and living in a world I really didn't understand. So my first sort of meeting was a bit, I'm not too sure, but I was very pleasantly surprised. You are welcomed with open arms. I think, as Alan said earlier, patient advocates are really welcomed now. You do feel part of the team. You're not just lip service to tick a box to say that, yeah, well, we've got a patient, tick, that's fine. And I've had so much help from everybody on every level, from the sort of top down, really, chairs of committees, the research assistants, the clinicians, the trial management people, oversight committees. I just can't really thank everybody enough for making it easy and interesting.
And it's a nice word you used, actually, the boffins, because it's almost sounds off-putting. And honestly, the boffins, as you say, they don't know everything. No one ever can, but they do love to give training support to patient advocates when they take part in their research projects. So sometimes you think of boffins, you think they're out there somewhere in the stratosphere, but then they are actually very approachable. In the meetings, you can speak to them and say, oh, but can you explain this? And then they will always go out of their way to say, yes, I'll explain it to you. Even if you think it might be something obvious to them, part of this training with support for patient advocates to the whole course of the study, not just the research stage, but even during it, is based on that whole team helping patient advocates to be involved and to do it well and to enjoy it as well.
And I think it's also because, sorry, Sally, I interrupt you, but just to underline that I think that the research planning has also changed a little bit in the last few years, where the involvement of patient advocates is through the research planning, but also in the grant application, but through the trial, let's say, development. The patient advocates are definitely more involved in a granular way. So you have more opportunity, for example, to, as you said, to ask for support or help and get to know each other. Because I am amazed that some of the patient advocates involved in our research are, I mean, I'm having more meetings with them for example, for changing some of the studies activities or to improve let's say recruitment. So I think has something that has changed in a positive way to involve more patient advocate and to enjoy this collaboration both ways.
Yeah, I think it's important, and it is all about teamwork, and as you say, collaboration. The more I do, the more I have to remind myself I'm there as the patient advocate. You learn a little bit more, you start thinking, oh, I know a bit more about that, but no, I'm a patient advocate. And very similar to Alan's example, my biggest contribution to one of the things I'm involved with at the moment, it's a project to see if study to see about giving self-injected pembrolizumab at home by the patient. And it's a great idea for people who live a long way away, and you know, sort of fine. It's been worked up in other things before it got there with other PPIE things, but we got to the stage where, well, we haven't got the funding, so the patient will have to go to the hospital to collect the prescription. So I'm there straight away, hand up in the air, going, well, you're defeating the object.
Exactly.
I've not thought of that. So funnily enough, they now have hopefully got the funding that the drug will be delivered to the home. So it's not rocket science. It's just somebody thinking about how it actually affects the patient, the carer. As you said earlier, transport to and from the hospital. We all know it's a nightmare. I've been to 2 hospitals already this week, and parking is horrendous. People have to remember that these things affect patients and their carers and patient advocates going to meetings.
And I think it's often underestimated, actually. I think the research team, the scientists, are sometimes so focused on the thing what they're actually evaluating. Sometimes they don't have enough attention paid to what the impact on patients are of taking part in the research project, let alone having that intervention itself. So that's a key bit.
Which is reflected to the costing when we're putting down this grant application. I think is of paramount importance to involve patients also for this kind of consideration on how much is the trial affecting your daily lifestyle and your finances. So the cost related, especially if it's a charity funded, for example, study. So without that input, as you mentioned, Sally, for the pembrolizumab, I think it was more difficult before to be aware of those implications. So I think it's very, very important. But coming back to your experience, have you got any help at the beginning to be involved in research? And did you find that this help has changed over the years to help researcher and make a more meaningful and patient-centered research?
Well, there was no direct training or anything as such when I started, but I had got some alliance experience things and working with patient leaflets. So I was a little bit ahead of the game of somebody starting afresh, but I wouldn't let that put anybody off. I mean, if you don't think, man, just just get in there. Everything I've been involved with has it been so helpful in your training. What do you need? The really helpful things at the beginning are glossaries of all the silly terms and whatever that you can give. The number of different abbreviations, acronyms, research terms, numbers. I mean, even now it goes over my head, particularly when Allan goes off on one sometimes. But it really helps. Just the basics. A nice basic glossary to start with helps you read the papers. And I think you mentioned earlier, not everybody's that much into IT. Some of these studies, you can have an awful lot of pages to read. And quite frankly, by the time I've scrolled through 40, 50 pages, I'm sort of glazed over completely. And it's really helpful to me if I get hard copies. And everybody I've been involved with, I say, oh, please can I have a hard copy or I have to print it out. Oh, no, we'll send you one, don't worry. But I think most of my training's been on the job and asking, well, all the people I'm working with, but other patient advocates who are working in different projects. I'd like to think there'd be slightly more of a, I think there used to be, I think with the NCRI, there was perhaps more of a training scheme as such. And like to think there'd be something, just a few pointers for the real beginners. And I think this series of webinars is a start. But the thing to say is you don't have to have a healthcare background, a research background. You just have to have, well, preferably patient experience of the cancer, be it yourself or a carer. And I think I'm very much for lung patients being involved in lung cancer research. But I just wondered how you felt about other disease managements, if it was somebody who was a well-versed patient advocate, if they wanted to be involved in the lung project. Is that okay?
Yes, we say yes. If they've got, because we're looking at people with lived experience of a cancer, ideally the cancer one's researching in, but if they've got quite a broad experience across other disease types or cancer types, there's no reason why they can't be involved, and they're very engaging. And it's particularly the case for for rare cancers. It's quite difficult to get hold of in a lot of patient advocates for rare diseases, rare cancers. So those patient advocates tend to come from different backgrounds anyway. So yes, I think the more the merrier.
Yeah, completely agree with you. And we had even non-cancer patient in our PPI group sometimes, because it's more, it really depends on the study, really depends on the question that sometimes you want to involve the PPI group. But I think it's very important to have, yeah.
And to follow on from what you said, Sally, there's actually now, over the last probably year, there's now online videos for patients want to be patient advocates to do some of that training that you suggest, as in the first go at it. So I've seen more of those materials now from various organisations. So they look like little videos, or they might be some very easy to read text. So there's more of that now to encourage people to say what's going to be involved, what kind of support do you get. So that's the sort of the initial support that you can go for, exactly that you asked for, which is best.
And I like the idea of having also something still printed, because this will also give opportunity to more people, to more patient advocates to possibly be involved. So sometimes we are naming involvement, of course, of GP practice, primary care, to advertise those training, because I had a couple of patient advocates that were not able to reach these online resources. So I think there is still need to reach out all the community and have those perspectives as well. So people from outside the big centers. So there is still a lot to do, but these are definitely the suggestion that as researcher we need more to possibly change the next generation trial design and implementation science, essentially, because you're part of research. So do you have, Sally, exactly any other question, for example, that you would have asked before in your experience of patient advocate, you would have liked to ask to researcher and you didn't have the chance to?
I think it's more about, I mean, we approach you, but it's what are you looking for in the person who wants to be the advocate, or wishes to be, or would like to be? What sort of qualities are you looking for?
I think it's the lived experience, and I agree with the comment from Allan and from you as well that, for example, even we call now main support person in addition to caregivers, carers, or spouses. It's just the patient who lived, of course, this episode of care and the treatment, possibly the specific treatment that will be assessed in the future trial, but also the village around them, because sometimes the effect of those treatment and future trials are affecting families, or again, more extended kind of families so much that it's very important to involve all this kind of community. So it's like, it's a multidisciplinary request, as in the healthcare system, we have multiple, let's say, specialty. I think that also in patient advocacy, we are now extending the invitation to be involved, not only to the patient who lived exactly the same treatment or the same disease, but as we said, even broader disease area, but definitely also carers or main support persons. That's my, at the moment, my consideration. Allan, I don't know you.
Yeah, I agree with that. So perhaps somebody who can give their views, and sometimes many people don't have a huge amount of confidence. Even people in the research team don't have a huge amount of confidence. I think sometimes perhaps patient advocates think they need to have this huge bubbly personality, and that's not the case at all. As long as one can give their views, that's one's looking for. That's what people are looking forward to. And if the views are different to other people's views, that's life, and there's always a very nice conversation over it, and then the two people will sort of come together. But we're looking for people who are really interested in research. They want to see research move on and take lung cancer patients forward, so better ways of detecting disease, treating disease, helping people to live longer in a better quality of life. So we're ideally looking for people who have got an interest in that, not just for themselves, because most of them had lung cancer, but for the lung cancer patient in the future.
Yeah, I think it's important. And again, just to wrap up, we will offer more support, but I think all the researchers nowadays are very, very keen to help and to give information and possibly make more comfortable this experience. And as you said, probably Sally is the first approach that will change, because people will see that it's a nice environment. And I can definitely see the difference between now and 10 years ago when I had my first experience with PPI groups, that patient advocates are more welcome in all the trial journey. So you have more opportunity also to boost your knowledge, and definitely researchers are more keen to provide those supports, even because, of course, as Allan is an expert here, but there are training already available, and more will be in the future. So I think is an invitation to be more proactive, and for us to be to welcome any person who's interested. So if you don't have any other question, Sally, Allan, or discussion, I think we will close here this first webinar, and I'll invite, of course, to send any feedback or any consideration to info@btog.org, and any potential new topic that you would like to explore, we are very happy to take this on board. But thank you so much for listening, and we'll see you soon for the second webinar of this series. Thank you, Allan, and thank you, Sally, again.
Thank you.
Thank you.